to today's information session about the FWO's fellowships for senior clinical investigators. My name is Christine and I'm a science policy advisor at the FWO. And also joining me here today is my colleague Helen Bolterberg, who is account administrator for the medical sciences at FWO. We hope that we can have a very interactive information session today. So after the general introduction of the program, we will have a Q&A session at the end. So if any questions already pop up during the presentation, please feel free to post them in the chat box and we will get back to them during the Q&A. But first, I will go over the main modalities of the program for senior clinical investigators. So to translate basic science into applications that directly benefit patients or general healthcare, you as clinical scientists are ideally placed. From your clinical experience, you know what the system needs and what the patient needs. And because of your scientific training, you're in an ideal position to advance practice-oriented research. And indeed, a study by Ankaars and colleagues has shown that clinical scientists are more likely to perform use-inspired research that builds on prior insights from applied literature. And moreover, their studies are more likely to trigger also applied follow-up research. Unfortunately, however, although clinical scientists could be an important motor driving translational biomedical research, in practice, they are often not free to do so because they are fully occupied in the clinic. And this is then where we at the FWO provide a solution by freeing funds to release clinical scientists from their clinical duties, giving them time to perform such translational research. And that same study by Ankaars and colleagues also investigated our fellowships, and the study demonstrated that our fellows have an increased publication rate compared to their peers, and also importantly that their research focus shifts more towards translational perspectives, which then also can have important consequences for patients and for the healthcare system in general. And an important remark to be made here is that this senior clinical investigator fellowship is part-time only, thus ensuring that the fellow will also remain strongly embedded in the clinic at the same time. So the fellowship is really quite unique in that respect. It will not be paid out to the fellows themselves, but rather to the hospital, and the funds will then be used to finance the clinical substitute. So usually the grant is meant for a 50% replacement. However, in exceptional cases where a fellow really cannot be spared from the clinic for the full 50%, there is also an alternative option available where the fellow will be replaced for 20% and the remaining funds can then be used to finance scientific or technical support staff. Typically, this would be a PhD student or a lab technician, but other options are also possible. Now, this 20% option should really be the exception rather than the rule. We still prefer our fellows to be 50% working full-time on science. And so therefore, this exception should also really be thoroughly motivated in the application. An example would be, for instance, a surgeon who performs very complicated procedures that cannot be simply taken over by a replacement. And in this case, it should also be attested in writing by the head of the clinic. So this brings me to the FWO's main goal for this fellowship program. And this will also be the main motivation that is related to our evaluators. So we really wish to select the most promising candidates who have a good track record, a solid project idea, and also a convincing vision on how to establish themselves as independent clinician researchers. So now for the practicalities, in order to be eligible to apply, you should be recognized to practice your profession in Belgium as a medical specialist or a GP, or alternatively as a pharmacist specializing in clinical biology. You should be working at a university hospital affiliated to a Flemish university, and you should have a contract of indefinite duration. For GPs, you should be affiliated to a Flemish University Department of Family Medicine for the duration of the fellowship. You should spend at least 80% of your time on purely clinical duties, meaning that you're not already working as a researcher, for instance. You should hold a PhD degree because it's a postdoctoral fellowship with no more than 20 years of seniority. And similar to all of the other FWO fellowships, we allow only 2 attempts to apply. But importantly, because the program underwent major revision a couple of years ago, since then the counter was reset and you can apply twice again, irrespective of any potential earlier attempts. The overall aim of the fellowship is to provide a platform for our fellows to establish themselves as independent researchers. And therefore, the fellowship has a duration of 5 years, and it is also renewable potentially 2 more times, meaning that in the best case, the fellow will have funding for a consecutive period of 15 years, which should give them ample time to build their own research line with long-term perspectives. And since the revision of the program, the budget has increased, and now there will be 60,000 euros per year available to finance the clinical replacement. And for GPs, the calculation of their annual fee will be based on the wage of a part-time lecturer at the university, also taking into account the seniority. In case the fellow has chosen the 20% replacement option, the remainder of the budget can be used to finance the supporting staff, but also here the maximum amount per year will be 60,000 euros. And what is new since the revision is that now our first-time fellows will also receive a bench fee to help them start up their research. This bench fee will amount to a maximum 100,000 euros for the full period, or 20,000 euros per year. And for the bench fee, the same rules and regulations apply as for our other pre- and postdoctoral fellowships. So what do you need if you want to apply for this fellowship? First of all, you will need the formal commitment of both the director of the hospital and the dean of the faculty. The hospital director should attest that they will provide actual clinical replacement for you. And here it is also highly recommended to already have the name of the person or the people who will be replacing you written down in the application. And second, they should also guarantee that you will be reinstated in your original position upon completion of the fellowship. And then the dean of the faculty should attest that you will be affiliated to the university to perform research for the duration of the fellowship. In addition, we also ask a letter of your clinical supervisor to specify your clinical duties and the plan for the replacement. You should submit your application via the e-portal on the FWO website. And because our jury consists of international experts, please make sure that your entire application, including all of the support letters and other attachments, are written in English so that the evaluators can understand it. The jury will evaluate several aspects of the application on the level of the candidate, as well as the proposed research program. And for a final renewal, also the future planning after completion of the fellowship will be taken into account, because as I've discussed already, it is important for us that there will be a continuation of these research lines in the future. So looking at the evaluation criteria in more detail, concerning the level of the candidate, for a first-time application, both the scientific experience as well as the clinical expertise are taken into consideration. Also, whether the candidate has already established connections to basic research groups that can ensure feasibility of the planned research program. The past and planned mobility will also be taken into account. And importantly, because we really want to protect the time of our fellows that they can spend on their research, we ask you to provide a very clear plan regarding the substitution of the clinical tasks. And this should, as mentioned, also be supported by the hospital management. For a renewal of the fellowship, the jury will evaluate the progress report of the previous term with a special focus on scientific growth and on international recognition. Also, the translational nature of the research and the impact on clinical practice will be taken into account. And again, the substitution plan will be evaluated as well. Then concerning the proposed research program, the jury will assess the innovative nature of the research, the quality of the proposed approach, its feasibility, and as mentioned before, also the clinical impact, meaning that the study should be translational in nature. And then for a final renewal, we would like to see that the established research lines have a long-term perspective, meaning that the hospital has plans to continue this also after completion of the fellowship, and preferably, of course, that the fellow will remain in the driving seat to continue this. So since the revision of the program, there are more stringent quality requirements attached to the renewal process. So together with the application for a renewal, the fellows will also submit their progress report of the past activities, and this will be evaluated by the jury following the criteria that were just mentioned on the previous slide. And importantly, in line with FWO regulations for other fellowships, there can be no second attempts if the renewal is rejected. And here you see a graphical representation of the success rate since the revision. So each year we have funds to grant 8 new fellowships, which based on the number of applications in the last round translated into a success rate of 50%. And out of those successful first fellowships, we will renew 6. And out of those 6, 4 can then be renewed for a third and final period. So overall, I think you can appreciate that in comparison to other programs at the FWO, the success rate for the clinical fellowships is quite high. And this is done intentionally because we realize, and we also know from surveys among our fellows, that it is really not straightforward for a full-time clinician to find the time to apply. And therefore, by having a relatively high success rate, we hope to keep the fellowship accessible, attractive, and make it worthwhile to apply. I would also like to reassure our current candidates for a second renewal, because of course we do realize that we are still in a transition period and that the selective pressure was not applied as rigorously during your first renewal. And so therefore we expect a larger number of candidates for the second renewal, and we will of course award more fellowships to remain true to the foreseen success rate. Then some important dates to note down. So the call is open since last week, and we expect the final submission by the 3rd of March, no later than 5 p.m. via the e-portal. The results will be announced by the end of June, and we strive to provide you feedback on the application shortly thereafter. You will all receive feedback regardless of the results. And if granted, the new fellowship will start on the 1st of October. Successful candidates will work under the regulations for senior clinical investigator, which you can find on our website. So once you're active as a fellow, and if you have not done so already, we expect a signed declaration specifying the details of your clinical replacement. And throughout the mandate, you will provide 2 reports of your scientific activities, one mid-term and one at the end of the term, which will be used to evaluate your renewal if applicable. And all of those reports will be assessed by the jury clinical fellowships. As most of you will be performing clinical research, I would also like to point out that we expect our fellows to adhere to the European regulation on the registration and reporting of clinical trials. We at FWO fully advocate the benefits of transparency of clinical studies, and we therefore expect you not only to register your trial, but also to inform us upon inclusion of the first patient, and obviously to report your results appropriately. Your compliance with these regulations can be taken into account during the evaluation of your reports, and as such it can also have consequences for your future applications at the FWO. So to conclude, here are a few additional tips and tricks on how to submit a winning application. So since the revision, the emphasis of the call is on translational research, because this is where clinical scientists can make the difference. So therefore, please make sure that your topic of choice is not only innovative, but also translational. And then following international trends to advance research assessment, the FWO is moving away from a one-sided quantitative bibliometric assessment of scientific performance towards a broader view of a candidate's achievements. And therefore, we have widened our application form, allowing you to enter a narrative of your main achievements in a more broad sense. And our evaluators, on the other hand, then also receive specific instruction to take into account this scoping view in the evaluation. The purpose of the fellowship is that the clinical researcher can build a research portfolio that has strong future perspectives, and therefore it is also important that the hospital will engage itself to continue what the fellow started. So please make sure that this commitment is attested in the proposal. In order for your application to have a higher chance of making the cut, we highly recommend you to check the score grid that the jury members will use to evaluate your proposal. These score grids contain all of the evaluation criteria and can be found on the Senior Clinical Investigator page on the FWO website. I would suggest that you try to assess your application using the score grid, and if possible, that you also ask one of your peers to do the same, to make sure that you check all of the boxes. And because we received some questions regarding ethics, I would also like to briefly highlight the FWO's ethical approval policy. So please note that we do not require you to obtain ethical approval of the proposed research upon submission of your application. The only exception to this is if you're planning research on non-human primates. In that case, ethical approval is required before the evaluation meeting. What we do ask you to do, however, is to complete an ethics questionnaire as a part of the application form. And this questionnaire is meant to help both us and you to know whether ethical approval of your study will be needed at a certain point. And it is then only after the fellowship has been granted that you should request ethical approval. And in most cases, this approval can be obtained right before starting these particular activities. However, for experimentation on human embryos, fetuses, embryonic stem cells, or non-human primates, then the approval should be obtained before starting any project-related activities. Please note that additional rules and regulations may apply at your host institution, so please contact the relevant university services in time to obtain more information. And then for some final advice before we move on to the Q&A session, so make sure that you obtain all of the required attestations well in time. For instance, the certificate that you're recognized to practice in Belgium, and also the required signatures from the hospital director and the dean. The content of their letters should be relevant and specific to your case. So for instance, ask your supervisor to describe your clinical activities and a concrete plan for the substitution. In case you opt for the exceptional 20% substitution, also do make sure to properly motivate this choice. If possible, also provide the details of the clinical replacement in full, because this will give you bonus points, as you will see in the score grid. And finally, also make sure that you have prepared or updated your Personalia page before the submission. You can find additional information and details on our webpage, and please also don't hesitate to contact us via email using met@fwo.be if you have any remaining questions or concerns. So with that, I would like to move on to the more interactive part of the discussion. So if there are any questions, feel free to write them in the chat or raise your hand and we will unmute your microphone so you can ask the questions directly. Thank you for your attention.